We all know that hair loss can be a real confidence crusher. Male pattern baldness in particular affects millions of people worldwide, regardless of age. And when it comes to finding effective treatments, Minoxidil and Finasteride have emerged as two of the most popular non-surgical options out there. But while these medications are widely used, most patients are unaware that they tackle hair loss in two completely different ways. Hey there, and welcome back to our channel where we dive deep into all things hair care and restoration. I'm from HairPalace Hair Clinic, and as a patient coordinator, I've accompanied the treatment of over 1,500 patients in the past 5 years. Today we'll be delving into the science behind Minoxidil and Finasteride, exploring their mechanism actions and potential side effects, and most importantly, their effectiveness in regrowing and maintaining hair. Minoxidil is a vasodilator, which means it widens your blood vessels. The result? Better blood flow and a kickstart for hair growth. You can get it as a liquid or foam that you can apply directly to your scalp once or twice a day. Finasteride is a little pill you take. It falls into the category of 5-alpha reductase inhibitors. Essentially, it blocks the conversion of testosterone into DHT, the hormone that contributes to hair loss. By keeping those DHT levels in check, Finasteride helps slow down or even stop hair loss. As such, it does require a prescription from your friendly neighborhood GP. In terms of potential side effects, Minoxidil and Finasteride differ greatly. As Minoxidil is a topical product, the most common side effect is some scalp irritation, which can cause a bit of itching, redness or dryness. In some cases, you might notice some hair growth in places you didn't expect, but those effects are usually mild and don't stick around for long. With Finasteride, some folks may experience side effects like lowered libido or trouble with, and you may experience breast enlargement and tenderness, which is also not the most welcome change. If you have any concerns, it's best to chat with your healthcare provider before starting Finasteride. Finally, let's see how effective Minoxidil and Finasteride are. Minoxidil's been proven to promote hair growth, especially in the crown area. It does more to keep your hair rather than having new strands grow. It's unlikely to prompt any hair growth in completely bald areas, but it does a stellar job of strengthening and thickening your existing hair. Sadly, you must keep using it consistently to maintain any results. Studies have shown that Finasteride can make a significant difference in reducing hair loss and prompting hairy growth. It works particularly well for the crown area and mid-scalp areas, but just like Minoxidil, you need to keep taking it to keep reaping the rewards. If you're wondering which of these hair growth powerhouses is right for you, Minoxidil and Finasteride actually work well together. By combining the blood flow benefits of Minoxidil and the DHT blocking powers of Finasteride, you might even get better results. But as always, it's best to check with your doctor first before devising your own treatment plan. If you're currently using Minoxidil or Finasteride, I'd love to hear about more your experiences in the comments down below. And if you enjoyed this video, subscribe to our channel. We post new videos every week, so you can take a look at success stories and learn more about hair restoration methods that can help you overcome hair loss once and for all. Thank you for watching.